Hello, thanks for watching this video. In this recording, I'm going to walk through the different ways that you can dispense medicine to a patient on the workflows. Don't forget what you're seeing right now where it says CliniPAK start and log out. That's what we refer to as the workflow side of your server. Don't forget, if you can't see the button start and log out at the bottom, then you need to zoom out on Google Chrome. Recall, you can do this by pushing the buttons with the 3 parallel bars up here in the corner, and then zoom out until you can see what you need. When I push start, you'll notice that there are 4 buttons available for me to do an action on. We're going to be focusing on the first 3. The last button, the View Medicines, will just show you what medicines you have in your inventory. Whether you choose Prescribe, Dispense medicines, or Dispense without prescription depends entirely on how you and your clinic hand out medicines to patients. Really, CliniPAK is designed to support 2 different options. Option 1 is that you have a patient, represented by the blue circle, who first of all, in the first step, is prescribed a medicine by a doctor or a nurse. Then, later on, in a second room, or with a different person, that individual, that patient, is then given the medicine. So this might be your situation if you have patients come into an exam room, get diagnosed and prescribed, and then get written up a prescription, which then the patient takes to your pharmacy or medicine distribution area and then actually picks up the medication. There are 2 steps involved in that option. Option 2 is everything sort of combined into one. Option 2 is such that there's only one step. A patient is prescribed and given a medicine at the same time. So you might have this situation where you have a patient come into an exam room, get diagnosed and prescribed a medicine, and then immediately the doctor or nurse will step out, grab the medicine from the storeroom, and come back to give to the patient. Your option would be option 2. So let me first walk through what option 1 looks like. If you have option 1, the first thing you want to do is you want to click Prescribe. You're prescribing a medication for the patient now. So as we know, just pick the patient that you want in your search here. Now here you're prescribing the medicine. So I'll select what I want to prescribe. Okay, now I've prescribed this patient 2 medicine. I'm going to say that I'm done. This prescription has been successfully registered. So at this point, the system has recorded that you've prescribed these medicines to this patient, but it has not decreased the quantity on your shelf, and nor will it decrease the quantity on your shelf until you confirm that you've dispensed the medicines. So it allows you to go straight into the dispensation rate on this screen, but I'm going to say no and show you how to get to it from the other screen. Now the patient's been added to the dispense queue. Just to recap, this first step was using the prescribe option to prescribe a patient a medication. This might be done when you're in the room with the patient by the doctor or the nurse. Now all of this can be happening simultaneously. So in one room, a doctor or nurse might prescribe the medication, and then in the other room, you have the system up and running on the tablet or the computer for the pharmacy staff to dispense the medication. So if I was working in the pharmacy, the next thing I would do, if I was working in the pharmacy, what happens next is the patient who's been prescribed a medication walks over to the pharmacy area. Now, when they're in the pharmacy area, the individual dispensing medicine would select Dispense medicines. You can see that in this queue, which we call the dispensation queue or the dispense queue, there's only one patient on the list. Only patients who have prescribed medication will show up on this list. Additionally, only the medication that was prescribed the patient will be available for selection. At this point, when I'm dispensing this medication, I'll just select it, confirm the amount, enter any prescription notes, note that you don't have to dispense all the medication to the patient all at once. If the patient decides they don't want to actually pick up some of their medication, you don't have to. You would just select Done. If the patient does want to select all their medication, you would fill this in with the appropriate prescribed quantity that you're giving them. Now I'm going to say Done. This is the dispensation summary. When I've confirmed this, my dispensation has been recorded. Now the system has registered a decrease in the amount of the medicines that were prescribed. Okay, that was option 1. As a recap, if you're doing option 1, you dispense medicines in 2 steps. First, you prescribe them, then you dispense them. If you're doing it that way, you would first use the Prescribe feature in the CliniPAK, prescribe the medicine, and then you'd use the Dispense feature after to dispense the medicine to the patient. If your clinic is one that has prescription and dispensation all in one step, you might be looking at option 2. For option 2, what you want to select is you want to select Dispense without prescription. Note that this doesn't mean dispense without any prescription whatsoever. The doctor might still write up a script, and hopefully it's being stored in the patient's medical record. However, what it means is that there's no prescription within CliniPAK itself. CliniPAK is just recording that there's been a dispensation. Here you'd select the patient, all steps that we're familiar with, and then you'd select the medicine you want to give them. Now I'd click Done. See this dispensation summary again. This is confirming that you are dispensing a medication. The system will automatically decrease the amount of this medicine I have in my inventory by 2. Now I'm done. My dispensation has been recorded. How you use CliniPAK depends really on the flow of your patients within your specific clinic. We're happy to help you think through what would be best for you and if you have any sort of different circumstances. Thanks for watching.